We're going to start out with the diseases and disorders built from word parts. So again, they're a little bit easier, prefix, suffix, word root. So, angioma, tumor composed of blood vessels. Angiostenosis, narrowing of a blood vessel. Aortic stenosis, narrowing pertaining to aorta, narrowing of the aortic valve. Arteriosclerosis, hardening of the arteries. Atherosclerosis, hardening of fatty plaque. Bradycardia, condition of a slow heart rate, less than 60 beats per minute. Cardiomegaly, enlargement of the heart. Cardiomyopathy, disease of the heart muscle. Endocarditis, inflammation of the inner lining of the heart. Ischemia, deficiency of blood flow caused by constriction or obstruction of a blood vessel. Myocarditis, inflammation of the muscle of the heart. Pericarditis, inflammation of the sac surrounding the heart. Phlebitis, inflammation of a vein. Polyarteritis, inflammation of many sites in the arteries. Tachycardia, condition of a rapid heart rate more than 100 beats per minute. Thrombophlebitis, inflammation of a vein caused by a blood clot. Valvulitis, inflammation of a valve of the heart. Erythrocytopenia, abnormal reduction of red blood cells. This also means anemia. Hematoma, tumor of blood, collection that has leaked out of a broken vessel into the surrounding tissue. Leukocytopenia, abnormal reduction of white blood cells, also called leukopenia. Multiple myeloma, tumors of the bone marrow. Pancytopenia, abnormal reduction of all blood cells. Thrombocytopenia, abnormal reduction of blood clotting cells or platelets. Thrombosis, abnormal condition of a blood clot. Thrombus, blood clot. And then within the lymphatic system, lymphadenitis, inflammation of lymph nodes. Lymphadenopathy, disease of lymph nodes. Lymphoma, tumor of lymphatic tissue, malignant. Splenomegaly, enlargement of the spleen. Thymoma, tumor of the thymus gland. Again, I cannot stress enough all those exercises throughout the book. They're going to help you. So here's a picture of aortic stenosis. You can see a normal valve, how wide the opening is, and then stenosis of a valve. You can see, it's reduced quite a bit, so it's harder for the blood to pump through when you have narrowing of the aorta. So which of the following is analyzed correctly? So again, they're wanting to have the slashes in between the prefix, suffix, word root, and combining vowels. So again, take your time, go back to where all the combining forms are listed. But hopefully you chose A as your answer, because sclerosis is actually one suffix itself. It is not broken down, so A is the correct answer there. And then we have one is a healthy artery with smooth blood flow, and number 2 is blocked artery due to thrombosis and atherosclerosis. So you can see the clot and the plaque that they're identifying there. So now let's look at diseases and disorders not built from word parts. Acute coronary syndrome, sudden symptoms of insufficient blood supply to the heart indicating unstable angina or acute myocardial infarction. Aneurysm, ballooning of a weakened portion of an arterial wall. Angina pectoris, chest pain, which may radiate to the left arm and jaw. Arrhythmia, any disturbance or abnormality in the heart's normal rhythmic pattern. Atrial fibrillation, cardiac arrhythmia characterized by chaotic, rapid electrical impulses in the atria. Cardiac arrest, sudden cessation of cardiac output and effective circulation, which requires pulmonary resuscitation or CPR. Cardiac tamponade, acute compression of the heart caused by fluid accumulation in the pericardial cavity. Coarctation of the aorta, congenital stenosis or narrowing which occurs in the arch of the aorta. Congenital heart disease, heart abnormality present at birth. Coronary artery disease, condition that reduces the flow of blood through the coronary arteries to the myocardium that may progress to depriving the heart tissue of sufficient oxygen and nutrients to function normally. Cor pulmonale, enlargement of the heart's right ventricle due to pulmonary disease. Deep vein thrombosis, condition of a thrombus or clot in a deep vein of the body. Most often occurs in the lower extremities. Heart failure, condition in which there is an inability of the heart to pump enough blood through the body to supply the tissue and organs with nutrients and oxygen, also called congestive heart failure. Hypertensive heart disease, disorder of the heart caused by persistent high blood pressure. It may be associated with hypertrophy or dilation of the chambers of the heart. Intermittent claudication, condition of pain, tension, and weakness in a limb that starts when walking is begun, increases until walking is no longer possible, and then completely resolves when the patient is at rest. Mitral valve stenosis, narrowing of the mitral valve from scarring, usually caused by episodes of rheumatic fever. Myocardial infarction, death or necrosis of a portion of the myocardium caused by lack of oxygen, resulting from an interrupted blood supply, also called a heart attack. Again, lots of terms in this chapter, so you might have to study a little bit more than usual. Peripheral artery disease, disease of the arteries in the arms and legs resulting in narrowing or complete obstruction of the artery. Rheumatic heart disease, damage to the heart muscle or heart valves caused by one or more episodes of rheumatic fever. Varicose veins, distended or tortuous veins usually found in the lower extremities. Now with the blood, you can have anemia, condition in which there is a reduction in the number of erythrocytes, which are red blood cells. Embolus or emboli would be plural. Blood clot or foreign matter such as air or fat that enters the bloodstream and moves until it lodges at another point in the circulation. Hemophilia, inherited bleeding disease most commonly caused by a deficiency in the coagulation factor 8. Leukemia, malignant disease characterized by excessive increase in abnormal leukocytes or white blood cells found in the bone marrow. And sepsis, systemic inflammatory response caused by pathogenic microorganisms, usually bacteria, entering the bloodstream and multiplying. This could be a life-threatening condition which may lead to tissue damage, organ failure, and death. The overwhelming presence of pathogens in the blood is called septicemia. So let's look at a few of these things that we just talked about. So AFib or afibrillation. Picture A is just a normal heart rhythm or sinus rhythm. B is AFib, and then C is arterial fibrillation ablation. So here is a picture of an aneurysm. You can see the weakened wall and the fatty layer lining the aneurysm, whereas this is what a normal abdominal aorta should look like, and here you can see it's protruded quite a bit. Coarctation of the aorta. Again, you can see how it's narrowing right there at the arch. Here are the common types of anemia. Again, same table that is in your book. It is table 10.1 in your book. So anemia due to blood loss. So acute blood loss anemia as a result of a hemorrhage. Anemia due to decreased production of red blood cells, or anemia due to increased destruction of red blood cells. Now, more diseases and disorders of the lymphatic system, not built from word parts. Hodgkin's disease, malignant disorder of the lymphatic tissue characterized by progressive enlargement of the lymph nodes, usually beginning in the cervical nodes, also called Hodgkin lymphoma. Infectious mononucleosis, acute infection caused by the Epstein-Barr virus, characterized by swollen lymph nodes, sore throat, fatigue, and fever. This disease affects mostly young people and is often transmitted by saliva. This is, what people call mono, or the kissing disease. So here they're just asking you, how would you classify the origin of the medical term Hodgkin disease? And basically that is an eponym. It was named after the doctor who discovered the disease. And that will end this